Ashok Kumar Garu, HOD of General Surgery, Dr. Padmasri Garu, Dr. Another important occasion for us to gather together, not to celebrate the cancer, but to create awareness against cancer. So, almost since my MBBS days, I used to have this culture of celebrating all the days, observing all the days. In other words, all the health-related days, tuberculosis day, likewise, World Health Day, likewise. So, amongst all those days, Cancer Day slowly, as we evolve into adulthood, from my MBBS days to now, cancer has become a major health problem in the society. So this change is only because of the change in the lifestyles, drastic changes in the food habits, increasing bad habits like pan para, gudka, smoking, alcoholism, canned foods, unnecessary foods which are not to be taken into the body, air pollution, as our beloved principal told, stress is like a rust to the iron piece. It's totally, slowly as the human being evolves into adulthood, slowly it will cause such a. So, as you pretty well know, irritation causes cancer. We used to see in the surgery textbooks. So, wherever there is irritation, there we used to have slowly the cells will evaporation of the cells into abnormal cells producing cancer. That is the starting of the cancer, beginning of the cancer. So, anyhow, you are all well known about all these facts. I don't want to go into the subject, but what our job as a medical professional in the society is to shoulder the responsibility of spreading awareness about the cancer. That's the only thing that we need to do in a vast society like India, where there is a population of ignorance, illiterate, poverty-stricken population, where we need to address this situation by just spreading awareness. Thereby, people will take their own health into their hands. That is the thing what we need to do. So that's what I request you all as medical professionals, nursing staff, paramedics, whoever is there in the health profession, they need to take this responsibility, because every one of us is at risk of developing cancer at any given stage. I think one or two in this premises, in this hall also there are one or two persons also might be having this cancer, maybe when they are survivors. That is, survivals of cancer are the best examples in this society, on this earth, giving us a hope, a rare hope, wherein we have come out of this 5-year survival rate to total survival and happy survival rates. So that is the message that is given by these survivals. So thinking or keeping this in mind, the NATCO Trust has come out with a novel idea of developing a cancer unit in a government hospital setup. They could have earned a lot of billions of money if the same center has been set up in a corporate sector, but they have not done it. They have done this in a government general hospital setup like GGH Guntur, wherein we are standing and talking about this cancer, this is the brainchild of Chaudhary Garu, the Nannapaneni V.C. Chaudhary Garu, which has been shouldered by Sadashivarao Garu and Ashok Kumar Garu. So, and it is supported by the government funding and giving the space in the GGH. Now it has grown into a very good, one of the most reputed cancer institutes in the government sector. So give them a big hand, and also not only it has really provided a cancer care to a poor patient coming here, but also it has built up a very, very good cancer department in a teaching hospital attached to a government medical college, that is Guntur Medical College. That is the beauty of this whole of the process. There is an oncologist, medical oncologist, radiation oncologist, a surgical oncologist. So many are given lot of opportunities to learn, and also it is giving them the livelihood, job satisfaction, and on the top of it serving a poor cancer patient coming here, which is an immense pleasure to any doctor. So that is what they have done, a great job of bringing up a very good cancer center in our GGH premises in Guntur, catering to the needs of almost whole of the AP state. Maybe I think from adjacent states also the patients are pouring in now and then. That is the beauty and trust of this hospital, this particular cancer center. I really congratulate and thank you all for doing such sort of very good service. Teaching is happening, at the same time patient care is taken care of, which is a real laudable thing. So, and another important thing is, so on this platform I just would like to, is there any dedicated toll-free number for this cancer institute? So now and then people are asking me about this. Either you take a dedicated toll-free number, or to create awareness to solve the inquiries that are there in the public mind. So that is my request. If you really can do it, that's another way of helping the patients. And telemeds, who have a very good unit of telemeds working with us, that also can be make use of their service also for the awareness of creating awareness in the cancer institute like this. And also another important thing that has been stimulated by our principal's message, that means that we all as a medical profession, now the lifespan of a medical profession has come down, which is really very alarming. Such an intellectual citizen of India doing our MBBS, MS, or MD, and further MCH or DM, and serving the patients like this. If they are really having less lifespan, really it is very unfortunate thing to happen to the society, because to make a medical professional it's not that easy, and to make a medical teacher it's not that easy. When they are really are having this particular risk of losing their life at early age, nobody will be happy about it. And so I am here for the safety of our own people working with us, especially the medical professionals and the nursing professionals. Their lifespan should be increased. That is our job. We should not make our staff working under pressure. We should make them to work with pleasure. Thereby their lifespan will be increased. One thing. The other one is, as our principal suggested, yoga and meditation definitely will improve our lifespan. So if you are really on this platform, I would like to request you all, I would like to convene a meeting with the Art of Living people, and so many are well known to me because I used to conduct such camps in medical colleges. I conducted our Superintendent principal, very good 2-3 campaigns were conducted. Our own medical professionals are there in this particular job. they are teachers, very good teachers, gurus in the meditation, in the Sudarshan Kriya, in the yoga. Our Dr. Hanumantrao, orthopedic surgeon's wife, is a very good teacher about this. So I would like all of you to get enrolled, sir. You just start the procedure. Please enroll. We will take 2-3 sessions. Your life is very precious. So is my thinking process. So I would like you to be happy, you to be happily leading a long life to serve the society at large. So, my dear doctors and whoever professionals who are working with us in our hospital, your life is very precious. That is what my thinking process. So, get enrolled. We will try to convene 2 or 3 sessions to involve everybody in this process. Thereby, because most of our lifestyle is pleasant lifestyle. We will come to college by 9. We will go to the home by 4. We will be family members. We will be happily enjoying our family life. So, if such a beautiful life is given to us by God and with your culture and character, so if this is simply involved in your lifestyle, this particular yoga, meditation, or breathing exercises, definitely it is going to help you out by improving your lifestyle, by relieving the stress, by alleviating the cancer-like situations. So keep this in mind, get enrolled. Once you are happy about this, definitely once we get good numbers, we would like to convene. This will be happening before 9 only. You should be prepared for that. 2-3 sessions, you can as well do it while you come to the college. 20 minutes, if you do it, definitely your lifespan is going to increase by 5 years. And that will alleviate the cancer also. That is the beauty of these techniques. So of course, unfortunately, something contrast to this happens. It's not in our hands. That is a divine power, or that is our destiny. That we would think that way. But most of it will work, and most of you can be saved and can be happy if you really practice these things. So, principal is very good, good person, wholeheartedly I am telling you. He is a very good person and very good at heart. So he stimulated me by saying this. I was thinking of putting before you all, but because of my time pressure and stress because of these early days of my taking charge, so I thought of taking it up later once some certain things are totally settled in the GCH. But now I would like to push it forward, advance it, my thinking process, because of the stimulation given by our good-hearted principal. So I thank you all for giving me this opportunity. Please create awareness in the public regarding the cancer. Thank you.